Hello, hello. Scale again here. We got our last chapter of mental health. Yay! Are y'all excited? I know you are. Don't jump up and down too much, but you need to listen to me on this last chapter. We're caring for patients with substance abuse disorders. And I know we see so much of this, and we probably have already had somebody in our family affected. We know how it goes, but let's listen to it from a nursing standpoint because you've not been nurses dealing with it. So let's talk about this a minute. Our concept for lecture today explains substance use disorder, tolerance, and withdrawal. Collect information from patients who are commonly used, abused, or who are using commonly abused drugs. Uh, Identify adverse effects caused by interactions between commonly abused substances and medications used in the medical care. Provide appropriate nursing interventions for a patient in drug or alcohol withdrawal. Um, Apply the nursing process to the patient experiences substance use disorders. Um, so here we go, last chapter. Y'all listen up, okay? Because we're almost through. A person has a substance use disorder um, when he or she has a problematic pattern of use of any of the substances or of abuse except caffeine. This disorder includes a combination of the following symptoms. The substance is used more often in a higher dose than the person intends. The inability to fulfill major role obligations at work, school, or home. The substance is repeatedly used in a physical hazardous situation. A strong desire to use a substance. A recurrent desire to quit or cut down on using the substance, unsuccessful attempts to quit using excess except for limited periods, continued use even though they are recurrent social or family problems caused by substance use, large amounts of time spent in obtaining, using, and recovering from substance use, or continued use despite warnings of health problems. With continued use, the user develops tolerance to substances. This means that increasing amounts of substance are needed to achieve the same effect or the same amount of alcohol uh, causes less effect. So, therefore, they have to go up and up and up on the amount of alcohol they have to get that same buzz they're looking for. Same thing with pills or drugs or whatever they're using. They have to go up and up and up to get that same buzz. When a person uses a CNS depressant or stimulant substance consistently and it stops, the individual will withdraw. Um, withdrawal symptoms vary among the substance of abuse according to their specific action. Um, so we need to collect information for a patient who are using commonly abused drugs. We need to assess the abuse history of every patient, notify the physician of recent use or regular use so the appropriate measures can be taken to adjust the dose of the prescribed medication. The nurse must present a non judgmental attitude and be accepting the patients as people, whether they use drugs or not. And that's hard for us sometimes as nurses, but we need to always be non judgmental. A general screening tool for whether a patient has problems with alcohol is the CAGE. It's called CAGE. Um, see box 53.4 in your text for this for substance abuse. The question that asks the patients what purpose of substance serves promotes the nurse's ability to help patient find other choices for coping or entertainment. So if they're coping or using a substance to block out something in their life, maybe we need to get counseling for that and see where we can go. Additional questions to ask the patient include how have you had any other problems because of drinking or drugs like social, job, legal? When was the last time you used alcohol or any of the drug? What was it and how much? Very important for us to know that. The DSM 5 lists 10 substance of abuse. Their commonly used substances include alcohol, opioids, sedatives, hypnotics, and analgesics. And that's ANXIOLYTICS. Stimulants, which are cocaine, amphetamine, and other stimulants. Hallucinogenics, PCP, and similar drugs, inhalants, cannabis, tobacco, and caffeine. So there's a whole wide variety of stuff that people abuse. Identify adverse effects caused by interaction between commonly abused substances and medication used in medical care. Medical management includes prescription of medication and therefore must include consideration of drug interactions and cross tolerance. Patients who have used drugs or alcohol recently are at risk for additive effects with prescribed drugs. Commonly prescribed medication that cause addictive CNS depression are the narcotic analgesics, sedatives, benzodiazepines, sleep agents, and aesthetic agents. That's like some of the stuff. One of our famous Michael Jackson, what he used was an anesthetic agent that he used more than, um, really a sleep agent. A person who is dependent on heroin or alcohol will be tolerant not only to these but other CNS depressants as well. The phenomena is caused. The phenomena is also called cross tolerance. So a person who is dependent on heroin and alcohol um, will be tolerant not only to these but to other CNS depressants as well, because they both depress, so they will kind of cross over and they will have the tolerance for any kind of depressant they may use. Cross tolerance is important to the anesthesiologist who may find that the patient needs more than the usual anesthetic to put him or her to sleep. Cross tolerance is important to the physicians and nurses because patients who are tolerant, um, again, they will need more and more and more to help with pain, help with whatever they're trying to prevent or to put them to sleep. So we need to provide appropriate nursing intervention for a patient in drug or alcohol withdrawal. Substance dependency treatment has two major phases: acute and rehabilitation. Acute and rehabilitation are the two major phases. In the acute phase, a person may be in the hospital or another inpatient or outpatient setting. The patient often enters treatment while intoxicated. Detoxification or removal of substance from the body begins in the acute phase. The withdrawal symptom also occurs acutely. Medical and nursing support are often needed during the withdrawal. Medications are used in the acute phase of treatment to provide safe withdrawal. For patients who primary substance of alcohol, abuse of alcohol, vitamin B is given to prevent Wernicke's-Korsakoff syndrome. Um, that's a syndrome that alcoholics get that they will go into some pretty severe um, they, pain, seizures, from that. Alcohol withdrawal is usually managed with a benzodiazepine agent, which is given in decreasing doses over several days to treat and prevent withdrawal. So a benzodiazepine may be given along with that vitamin B to help to lessen some of the withdrawals. Alcohol and barbiturate withdrawals can be life threatening. The second phase of substance dependence continues indefinitely. Medication used in rehabilitation phase of the treatment are for the purpose of preventing relapse. Antabuse, Antabuse, may be prescribed to deter patients from drinking alcohol. It causes a severe uncomfortable reaction when the patient drinks, a flushing, a throbbing, headache, nausea, and vomiting. It's not used greatly because patients, number one, would take it if they're going to drink. Methadone is a synthetic opiate. We hear a lot about methadone. It's used to replace for heroin. Heroin is the goal is to prevent the risk of intravenous drug use as methadone is given orally. So they give methadone to replace heroin to keep them from doing injections directly into their vein from heroin. The naltrexone or Revia is an opioid, and that's Naltrexone, and the brand name is Revia, RE, then capital VIA. Is an opioid antagonist used to treat opioid overdose. It has been found to reduce the cravings for alcohol in abstinent patients. So they still will have cravings. So if they're really, really trying, some of these medicines will go a long ways. Um, Catapress is an antihypertensive drug given to patients with opioid dependence to prevent some of the symptoms of withdrawal. Nurses should take the patient's blood pressure before each dose and hold the drug if the patient is hypotensive. So, catapress, a blood pressure medicine, is sometimes used for opioid withdrawal. So, we need to think about our nursing process. A nursing process for a patient who is abusing or dependent on substances is at risk for injury related to alcohol withdrawal. A possible expected outcome for this patient will have stable vital signs within normal limits and will not suffer injury due to alcohol withdrawal. Another nursing intervention is risk for injury related to alcohol withdrawal is taking vital signs frequently. If the vital signs are elevated, medicate the patient with the benzodiazepine according to the physician order. Additional interventions include assessing for withdrawal, anxiety, agitation, sweating, nausea, vomiting, tremors, and ataxia. Offering small amounts of fluids frequently but not pushing fluids is if the patient is nauseated, and offering high calorie foods, maintaining a low stimulation environment for the patient, encouraging expressions of feelings about drinking and what the patient is experiencing. Um, so another nursing diagnosis that we can use for patients with substance abuse or dependency is deficient knowledge. A lot of people just don't understand how they can get off. Substance abuse and its consequences. We will have possible expected outcomes to this diagnosis. The patient will list or acknowledge the consequences of the substance abuse. Intervention for nursing diagnosis of deficit knowledge include assessing what the patient knows and what they need to learn. Teaching patients about the process of drug abuse and dependency and how people use drugs for coping, recreation, and company, and reviewing the consequences to the patient of the substance abuse. So we always need to kind of talk to them about that. Not during the time they're withdrawing or actively withdrawing, but when they get ready to go home, they need therapy. They need to be in some kind of withdrawal program. We know the famous one is AA, or there's the ones for the opioid withdrawal that they go to a group every week and they talk to people. That sometimes helps greatly. A third nursing diagnosis for individual substance abuse or dependence is ineffective coping. With possible expected outcome, the patient will have a plan for healthy alternatives to substance abuse for coping. Nursing interventions for ineffective coping includes helping plan for a new healthy coping strategies to replace substance use, helping make a list of fun recreational activities, and help patients identify the resource for various needs in stressful situations. Other nursing diagnoses that are commonly applied to people with substance abuse disorder or compromised or disabled family coping, chronic low self-esteem, powerlessness, fear, ineffective denial, imbalanced nutrition, less than body requirements, disturbed sleep, pattern, social isolation, spiritual distress, disturbed sensory perception, and risk for violence. Um, all those can be part. It's a pretty sad disorder. We know most all of us have been impacted personally with this disorder. It's a growing problem, but we need a lot of education. Um, we need a lot of peer support, family support for these patients to enter into sobriety and stay. That is all on this chapter. We will be talking later. Y'all have a good day. Thank you so much.